Okay, good morning, everybody. This is Smile with Sai on Saturdays. And today we have a wonderful guest with us, Dr. Akankasha Goyal. She's an endocrinologist at NYU. So, it's going to be a very exciting talk as we listen to her journey as to like how she became a doctor, how she came to the US, and what she does right now. So, yeah, I think we're just here to have fun on a Saturday and just listen to the journey and the voice of actually all our clinicians on our platform. So, welcome, Dr. Akanksha Goyal.
Thank you, Sai. Thank you for having me here. I'm really excited to be here. Smile with Sai on Saturdays. It's a very smiling topic.
Yes, yes. Awesome, awesome. So, very quickly for the audience, just wanted to quickly give them a quick intro about direct shifts, about me, and then we'll listen to mostly from you, Dr. Goyal.
Yes.
Okay. So yeah, so I'm the CEO and founder at Direct Shifts. And what we do at Direct Shifts is we connect clinicians to employers for short-term or long-term opportunities. Our mission is to use technology to cut down the administrative burden and help find clinicians their next favorite job. Could be a short-term opportunity, it could be a full-time, and people can go to our website, can see all our jobs, sign up, receive all alerts from there or through our mobile app. So this is in short what we have. We have opportunities all over the United States for all specialties and occupations. We started off with physicians, but then slowly grew to all occupations. We have opportunities from a hospital to a clinic to telemedicine. So all different kinds of opportunities. So do check us out at www.directshifts.com. So this is about me and this is about us. But turning over the mic to you, Dr. Goyal, would love to hear a little bit about you and tell the audience who you are. Give them a quick intro about you.
Okay. Um, I'm Akankasha Goyal. I'm a physician. I'm an endocrinologist at NYU Langone Health. And I really enjoy what I do. And I'm really glad to be here on Direct Shift Show because, like I said, it's good to have opportunities, especially in today's world. So I started very young in this field when I used to shadow my grandfather. But in my entire family, there's no one is a doctor except for me and my grandfather. So my father's father, and I used to see him back in India, where he used to have like one room, and he would used to do like private practice and see patients for general medicine and take care of their cold and cough and like basic symptoms. And a lot of those patients would not even have money, so they would just give them like fruits and vegetables, and that's what my grandma would cook that day. So it was a very humble beginnings, and I used to love what he used to do. It was a lot of chit chat, talking to patients, knowing about them, and helping them in whatever way he could help them. My grandfather has like five kids. All of them are not doctors. They're all engineers or in other fields, and I'm the only grandchild who's actually a doctor in his in his heritage, and it's nice. I started in Delhi. That's where I got my medical education, my medical schooling. Then I applied for the US MLE for further studies. I came from Delhi to the Bronx. I was in the Bronx for 7 years at Albert Einstein College of Medicine and Yeshiva University, and it was it was an amazing time. It was an absolutely amazing time to be there, to enjoy the culture, the nitty gritties, and to to learn so much. And then eventually, during my education, I realized I wanted to do endocrinology, which mainly deals with diabetes, thyroid, a lot of hormonal disturbances, fertility, menopause. And what happens in our profession is we talk a lot. We chat with our patients a lot, and that's what I realized. We give them some medications, but we also like chat with them, we talk with them, we know about them. And over the past 5 years, my patients know me, I know them, because at times it's a personal story. It's about obesity, it's about weight loss, it's about fertility, it's about thyroid. and we make some changes, but a lot of it is like education, a lot of it is like behavior changes, a lot of it is like, like small steps we can take in making our lives better. So after being in Bronx for 7 years, I got the opportunity through my mentor at Einstein to join NYU Langone, which in 2016 was developing its endocrinology unit. And I've been there for 5 years, and it's absolute fun. It's absolute joy. Uh, During COVID, I would look forward to go over there.
Yeah.
My husband would not, but I would look forward to go over there. And even now, it's just absolute fun to be there.
That's awesome. That's awesome. So lovely to hear. Oh, and I think we have a lovely picture of you probably there. That is fantastic. So awesome to hear your passion about what you do. Yeah. That's a great picture. Thanks
Oh
for
my
pulling that up.
God.
And
I didn't even know this existed.
yeah,
Oh my God.
yeah.
Okay.
That's a great picture where actually you're explaining something to somebody, it looks like. Um, so no, actually, so just to roll back the time, such a interesting story. So it looks like you used to hang out with your grandfather,
Yeah.
and that's kind of what draw you to medicine. Is that what happened?
Yes, because I mean, my parents would drop me off at my grandparents while they used to like go for their jobs or like earn a livelihood, and it was me, my grandfather, and my grandmother, and I would just like be on a little side stool or something like that at times and see what he's doing, because he had a clinic in his own home in one of the rooms, and just like, and he was old at the time, so he was also kind of retired and semi-retired, and just like see like what he's doing, and like see like how he is helping out, or how he's listening to the complaints or like to the symptoms. It was just so much. It intrigued me like people would come every couple of minutes and share their pain and their inside stories with him, because I was like, what kind of a job is this? Like, people come and like chat with you, and they give you fruits and vegetables. So it was very intriguing. As I grew older, I realized like how he's helping them, and how he's like making a change. And this is like back in the day. This is like 20, 30 decades, like years ago. So it really drew me, like, because I thought this is not numbers. I'm not good with numbers. Everyone who knows me knows I'm not good with numbers. So this is something, it's like making a difference in our own way in this huge world.
Awesome, awesome. That's really fascinating. That's fascinating to hear. So your grandfather must be very proud of you.
Yes. So unfortunately, he passed away just before I entered the medical school, but he knew that I was
Oh,
like
sorry.
prepping
Okay.
for that, and he knew I would get into that because he thought I was very bright. So, um, but yeah, he was the one who kind of like was the only person around me who was a physician, and that's how I drew into this profession.
Awesome. Awesome. So that's great. And so you have a lot of experience where you have seen, you've been working in India, you trained and worked in the Bronx, and then you chose endocrinology. So firstly, I think would love to hear about like what have you seen as the difference, in various countries as they practice medicine. Would love to hear your thoughts around it.
So there is a basic difference in the infrastructure, the health infrastructure in every country. And I feel that in India, it's very subjective. Like, it's more like clinical based. It's patients. There's so many patients to be seen. Patients come in, you examine them, you listen to their story. You have basic labs. They do what they can do, and you offer them your services and guide them their management based on that. In US, it's more like more centralized. So patients come in with appointments. You do a bunch of investigations, and then you give your professional opinion about, this is how we should go forward and this is how we should not go forward. But at the end of the day, uh, the diseases I take care of is diabetes and hormones,
Yeah.
which basically deal a lot with lifestyle changes and behavioral changes. So no matter which country you're in, it's basically how you can make changes in your lifestyle. And that's what we talk about in most of our clinical discussions with the patients. What can we do within our own parameters to make our lives more more healthy, and to make our metabolism quicker and faster, and to like lose those extra few pounds which we have gained in the holidays or because of the pandemic. So in that way, it's similar. And right now, because of telemedicine, it's interesting because of telemedicine, I have seen Egypt, I've seen South Africa, I've seen Amsterdam. Uh, because a lot of my patients are all over the place, and it's like, we're sitting over here. I was
Yeah.
like, okay, so show me outside the window, and they will show me like the streets and the local vendors, and whatever the scene is. I've seen so many parts of the United States, like Ohio, like I've seen Arkansas, I've seen California, just because it's all like people are all over and they can easily connect. And then we say, okay, what's going over there? What's the local food over there? Like, what are you having over there? Like, so right now in the world of telemedicine, it's a whole new world, and it gives me a lot of insight, and into what's happening in their lifestyle. And the boundaries have merged a bit in between like different countries and different states, just because everyone is all over. And it's very interesting in that way.
Awesome, awesome. That's really fascinating, and so great to hear that, through your patient's eyes, you're also able to like see
Oh yeah,
different parts of the world.
I have. It's very fascinating. And then they'll send me photos of those like places or something they've seen, like a local market where they get the fruits from or veggies from, so or the meat from. So it's very intriguing.
Awesome, awesome. So obviously, it looks like you're a very personable physician where you connect so well with your patients that they're showing you things and they're sharing their pictures and their life with you. Yeah, that's actually so wonderful to hear. So, is that so? Why did you choose endocrinology? If you don't mind, answering that.
Of course. Again, it goes, that would say from India. In India, we do have a lot of diabetes. We have so many patients, young and old, with high blood glucose and high blood sugar, and tackling with the complications back in the day. Now, things have improved, but back in the day, there were so many complications because it was uncontrolled. There was a social stigma attached to it, like back like a few decades ago. And that drew me into it because it would affect your heart, your liver, your kidneys, your mental well-being,
Yeah.
and also your lifestyle. Because before having every single food items, or like having a drink or something, you would think about the sugar content. It's not, life is not simple that way. So that's what drew me into like the field of endocrinology, and that's what my main practice is. I take care of a lot of patients with
Right.
type 1 diabetes. These are young people who got diagnosed early in life with, um, decreased insulin from their pancreas, and that's why they have diabetes. And how I can help them, how we can help them. And nowadays, there's so many gadgets. If you see the world of endocrinology, they
Yeah.
have so many, they have insulin pumps, they have glucose sensors. There's so many gadgets out there. And a lot of my patients are engineers and software people. They have whole like Excel spreadsheets. Like, these are my numbers. Like, this is what's happening. And it's fun. I'll tell you a story. Like, I have a patient who has diabetes, and she figured out that if she has one scoop of Eddie Brown's, the slow churned ice cream, the mint flavor, her glucose remains exactly the same. It doesn't move.
Okay.
And so it's interesting. It's interesting how you can help make people like enjoy life without, giving up on their pleasures or on their flavors. So yeah, that's like, and I would like to continue doing that.
Awesome, awesome. That is so interesting to hear that. all of us can still have, maybe all of us can still have one scoop of ice cream and our sugar levels don't fluctuate so much. I don't know about others, but maybe not for me, but maybe for
It was a
others
very
it's effective.
specific brand. He was like, not Haagen Dazs, not, not Ben and Jerry's. It was just this particular one. I could have this much, and that was perfect for me. I was like, okay.
Okay. Okay.
Yeah.
That's great. That's great to hear. And you were obviously trained in the Bronx and then you shifted to Manhattan.
Hmm.
Did you find any differences, in terms of the practice itself or patients?
They are, I mean, there is a difference because in the Bronx, I was doing more clinical research, uh, whereas in Manhattan, I'm doing more clinical practice. So that's one basic difference. I was doing more research. I was seeing patients with diabetes, but giving them more of a research perspective and not clinically seeing them that much. Over here, I'm seeing them more clinically, but doing clinical trials or helping them, like, enroll in clinical trials and give them some financial assistance with their medications. That's one thing. The second thing, in the Bronx, I feel like when I used to see the patients, they used to come with like a lot of time, and it's like more of those, like a lot of Italian patients. Like, it was a very different vibe. In Manhattan, usually it's more like patients are so involved. Over here, patients would like be very, very extremely involved in their medical diagnosis. They would read up, they would have valid questions, and they would like to move forward in making the numbers better or making the hormone levels better. So they read up a lot more. They're much more insightful into their disease and into their management. And also, people are so busy. Like, a lot of my like patients we see are, working in the finance industry or in like very heavy professions, which are very intense, kind of sedentary professions. And there's a lot of like emotional, mental work pressures associated with that. So the vibe is much more intense in that way. So they're juggling between a lot of things. So it's different. In the Bronx, it was very easy. A lot of patients, like a lot of my patients, would be they would have a lot of time to take care of the disease, and it would be a more like a suburban feel to it in a way.
Yeah. Yeah. Okay. Okay. Awesome. So now I always ask this question as, if not for being a physician, what would you be? What would be your
Oh,
alternate career?
I know that answer because I made my sister do that. So I was very interested in economics, and back in the day, like, we had a subject of economics. I was like, this is very fascinating. This is interesting. So I got into medical field, but I would used to tell my younger sister, like, this seems like a fascinating subject. This is very interesting, and this is like, like a learned behavior. And she realized this is a fascinating subject. So she mastered in the field of economics, and at times I would see her books, like back in the days. So if not a physician, I would have gone in the field of economics.
Okay. Okay. That's great. That's great. Um, During your path, as during your journey as a physician, did you have any people, obviously your grandfather was a great influence on you to choose the field of medicine, but anybody else that were influential in your path, in your journey as a physician?
Of course, my parents supported me like through and through. And I mean, they nurtured me, and they was like, yes, you can do it, because it's not easy to be, there's so many levels of competition, and you need a strong mental well-being and a strong-willed person to support you. So my mom and my dad, like, they helped me in whatever they can help me, to tackle all those, like, hurdles and obstacles and reach where I am. So absolutely, they were 100% behind me. So that, like, I come from a very strong family in that way, and promoting education, highly promoting education. And also, I came to the Bronx. In the Bronx, there were two people who really influenced me a lot. One, within like a month or two into the clinical rotation, um, I met Dr. Norman Fleischer, who was the chief of endocrinology. He's no longer with us, but he like I was like rotating with him and like learning from him, and he realized that I was smart. I can do this. It's like you should like this comes naturally to you, So this is very nice, and he would like give me like more questions and more like it was just very like he like nurtured like okay I can go into this field of endocrinology and specialize into it. And the second one is Dr. Meredith Hawkins. She's my mentor. I absolutely love her, and she made me passionate about this field. She made me realize that uh, it's not just like taking care of patients. There's a lot more peripherals involved. There's a lot more social and human aspects involved to clinical medicine. And she was the one who, like with her, whom I did like research. I went to CMC Vellore to do clinical research during my vacation time. And she she made me feel that okay, by doing small changes with patients, you can make a big difference in their lives, in the lives of their caregivers or their loved ones. So those two professionally are my biggest supporters and biggest influencers in choosing endocrinology as a field.
Okay. Okay. Great. 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 And now, if we were to ask you, what career advice would you give to people who are choosing, they're young, they're just trying to figure out where they want to be, whether to choose medicine as a career or not choose medicine as a career. So one for them, and secondly probably for uh, medical school residents who are trying to understand and break down, saying, hey, should I choose or specialize in endocrinology versus cardiology, anything there? What pieces of advice would you give each one of these people?
So I always tell um, whoever I meet, because we do meet a lot of medical students and people in various, levels of training. Do what you like to do, because you need to like what you're doing to continue doing it. It should not feel as a pressure. It should not feel like you have to do it. It should come naturally from you, and you should enjoy going to work and going that thing day in and day out.
Yeah.
So and if your heart is not in there, do not go for it, because you should like do what you got to. Life is too short, so you should always follow your passions. So to choose medical career, it's it's a long road. It's a long road. I have a sister, and I have seen other people who are not in medical field, and as compared to that, it's a long road. So you have to do many years of training and education, because you're dealing with patients' lives, people's lives. It's an error can cost much more as compared to any other field. And like it's a long road. So if you have to choose to go into medicine, be prepared. It's going to take a lot of resilience, a lot of training, a lot of a strong will, but you'll get there. It will be done. But you need to like have that, think in your mind that it's going to take like 10 years or something like that. But that's okay. I'll get there. So it's a long road if you want to choose medicine or surgery or any other medical field.
Yeah.
But it's a very satisfying road. It's very thrilling. It's very it has multiple dimensions and multiple moods associated during the entire journey. Once you are in the field of medicine and you are a medical student, then it's more like, okay, do I want to do surgery? Do I want to do medicine? Do I want to do gynecology? Do I want to do a radiologist? Like what specialization? There are a lot of memes about it, like do this profession or do that profession, because everyone thinks like we are the best, which they are in their own ways. Um, you go through each uh, training, in your medical school, and that's how you decide. But what I feel, and I've seen a lot of people tell me that, it's like it's your mentor who you connect during your training, which physician or which doctor you connected with, and you just follow that person. If you met an amazing surgeon and you connected with that surgeon, you'll end up becoming a surgeon. If you come into contact with an amazing radiologist and you liked what he's doing and his passion like resonates with you, you'll start enjoying the field of radiology. So a lot of times people choose what they choose because they came in contact with an amazing mentor or a physician or a clinician or a researcher, and they want to do research or become a PhD then, and like an MD PhD. So again, explore. When once you're in medical school, you can you have opportunities to meet so many clinicians, researchers, PhD, postdocs. Explore and see who resonates with you, and that's how you're going to know, like, okay, this is how I'll end up being. Of course, and you should like that profession, but a lot of it is also with the mentors you really end up liking and following.
Yeah, yeah, absolutely. And love what you just said, which is, life is short, do what you love. That
Yes.
was such a great thing for all of us to hear. And yeah, I mean, just following that thought process, what advice would you give to, physicians who have already graduated and they're looking for a job opportunity, or they're trying to figure out the puzzle, do you want to work for a large hospital? Do you want to work for a clinic, inpatient, outpatient, research, academia, nonprofit? What advice would you give them?
Oh, so that's a very good question. I feel our job profiles for physicians, they keep changing
Hmm.
as life goes on. And we should never feel that, that this is the job, that this is the job, which a lot of physicians feel like once they settle into a contract. Um, you should always, we can always make changes in our job profiles as time goes on. For example, like when fresh out of training, we want to do a lot of clinical, so you want to get into uh, a group of people who are very um, who are very nice people. You want to work with people who are nice people, personally, socially. So you always want to go with a nice group of physicians, administrators. That's because that's what you're daily working in and out with. And then further on, like in terms of academic or private practice or research, you can keep growing into it. You can start with like private practice or academic, do more clinical. Then you can have some research into it, some like education or training into it or teaching into it. And then you can scale back one of the components and go for the other component. So I always say, like, when you enter a job, look for the people you're going to work with. And the other clinical aspects, look for what you can do at that point of time in life. And then as you go further, you can keep changing your job profile. You can keep changing your clinical responsibilities or your teaching responsibilities or your research responsibilities. So,
Yeah,
but the people you're working with is the most important thing when you're signing a contract.
awesome, awesome. By the way, we just have a question from one of our audience, live audience members who are asking, and this is, I'm just going to read out what they said, which is, so nice to see you. Thanks for what you do. Question for you: how do you personally measure and track the progression of your quality of practice of medicine? And second part to that is, what guidance would you give to other physicians as to track their quality of practice?
Okay. So that's a very good question. And the key word is the quality of practice, not the quantity of practice. If
Yeah.
you see, in a clinical field, at times it's the quantity, like how many patients are you seeing, how fast the turnover is, how fast the revenue collection is, which is like quantifiable, very much quantifiable. The quality of practice is very hard to measure or to track. But the best way to do it is, one, to keep yourself updated with what's happening in your specific medical field. So go for trainings, do online courses, like keep updated, keep reading. And for me, the best way I track the quality of my practice, my services, is when I talk to my patients, when they keep coming back to me, when they share their personal stories with me. That tells me that I have achieved something with them, and the quality of practice is going in the right direction.
Yeah.
because especially with telemedicine visits and a lot of electronic system, we use a lot of like my chart and messaging with the patients, not even like calling, like messaging. And when patients at the end of the say, thank you, Dr. Goyal, like you're reachable, you're approachable, that tells me that I've attained a good quality of practice with my patients. And that's how I personally track that I'm approachable and easily reachable uh, to the people I care about.
Awesome. So great to hear that, hey, patient satisfaction is one way where you are able to track
Yes,
quality of your practice.
yes,
And,
absolutely.
just holding yourself up high standards by keeping up to date with the latest in your clinical technologies or anything there, that's holding yourself up there. That's both are really, really important. That's great. um, and just I think dreaming beyond this, right? Like, if you were given $100 million to spend and improve healthcare in this nation,
Oh,
how would you do it?
oh my God, that's a lot of money. That can actually make a lot of change in a lot of ways. Um, honestly, sir, that's a bummer. Like, there's so many different things you can do with that money. Like, I don't know. I mean, I would like use a lot of it for education of the patients, for like like giving
Yeah,
them those like because in healthcare, like the more people are educated, the better they can take care of their own health. So one is spending a lot of money in patient literacy, patient education is one way to improve healthcare as a whole, I feel. Uh, and second is making it accessible. I don't know how to say that because I'm not an entrepreneur, but making healthcare accessible
yeah,
to patients, which it is not. You would think it is, but it is not. It's not easy to have access to healthcare or to professionals or to physicians right now. So,
yeah,
in whatever way I can, like um, in whatever way the $100 million can help people reach out and easily reach out and to physicians or healthcare providers and take care
yeah,
of
yeah,
their pressing issues. That would be nice because the access to care is not easy in a lot of
yeah,
parts.
yeah, absolutely. No, that's so great. Like, education and access to healthcare, improve
Yeah,
these two things. It could go a really long way.
yeah.
That's great to hear. So, last question for you. Through this pandemic, definitely it's been a very challenging time for a lot of frontline workers. How have you managed to, keep strong, keep your mind strong, and go through this? And what advice would you give other clinicians out there to keep themselves strong? And as we see the light at the end of the tunnel here.
So personally speaking, for me, the one and only thing which helped me in the past year is I have an amazing group of friends and family, and have an like I'm blessed, knock on the wood, and I keep telling my husband the same thing. My social circle is something which made me strong and helped me pass through this tough time and kept my spirits up and about.
Yeah,
We would do Zoom calls. We would, chat over the phone. We would have like group messages. Like in whatever way we can connect, we would keep connecting and asking, is everyone okay with friends and family? Uh, and cooking different dishes and like, sharing the recipes and doing so social having a social circle is a very important thing, even if it includes one or two or three
yeah.
people, but just being connected to another human being keeps you sane. So I think that really helped me with this pandemic.
Okay, okay. And so, any advice would you give to clinicians to as they're going through this?
Um, Well, it's all like you said. It's the almost the end of the tunnel,
Yeah.
and the first advice is it's almost there. It's almost there.
Yeah.
And the other advice is like keep doing what they're doing. It's not even the physicians. I feel like what I felt like the nurses, our staff members, our support system in terms of the technicians, like the office managers. They helped us so much. Like I really salute the nurses and the managers who helped us so much through this because they would take care of so many things which we didn't have to think
Yeah.
about. So and like they really deserve a true hands of appreciation because that was amazing.
Yeah.
But for physicians it's almost there. People are so much like uh, you know educated about this new medical diagnosis, and they are getting in terms with COVID-19 and making lifestyle changes in accordance to this pandemic. So hopefully this is going to be a better year, a nicer year, a more open year, and we can be out and about.
Awesome. Awesome. That's great. That's great. I think we might had one more question from our audience. We'll just see if there's anything. Okay. I don't think so. Okay. So that's great. Thank you so much, Dr. Akanksha Goyal, for being here and spending time with us on the Saturday. And thank you for all the advice that you've given all clinicians here. We really appreciate you coming to our show.
Thank you so much for having me. It was amazing. Smile with Sai. It's a Saturday.
Yes. Great, folks. So once again, folks, thanks for being here with us. If you are in the audience, please like, share, and subscribe to Direct Shifts, any of our social media platforms. And then we're definitely live. You can go to our site. You can see all our activity. And yeah, look forward to having a next guest next weekend. But until then, have a great weekend and week. Take care, folks.